Hello everyone, I am Paredi and I'm the representative from the team Healthy Minds World. Good morning. I hope I'm audible to all of you. Okay, perfect. So, very good morning to all of you. Thank you so much for joining our session today on the effects of marital discord on mental health. To start with, it's little strange that we've almost reached 140 days into the lockdown or dealing with the virus, and there is no there's no certainty as to when things might become better or when we will relatively be a little free, so to say. So seeing you all today here, I mean, not seeing you, as participants in this session is uh, definitely nice, given that, on a Sunday morning, how some of us usually prefer sleeping in a little late. So thank you so much for joining today. And for those of you who've been a part of our journey before, thank you so much. It's incredibly inspiring and motivating to see your continued presence. And for those of you who are joining us today for the first time, I hope you do have an amazing session. So, to start with, I'm going to give a little background about us, Healthy Minds World, and the team. So, as an online platform, Healthy Minds World was started by Pallav and Vivek almost around the same time as when the lockdown came into being. And they had been working together on a different business model, which was also impacted by the virus, by the lockdown. And their conversations post that, in order to understand not just the impact on their professional front, but also their personal front, especially that of the mental health, was something that brought about this realization that at a time like this, when people were locked up inside their houses, uh, chances of the need for increasing the awareness around around a positive mental health, right, which includes aspects right from understanding what positive mental health is, what are the different kinds of mental health disorders, and how to go about it if you see signs, whether in yourself or in someone around you. So with that, we started our journey, and we're a team of more than 10 young individuals, ranging from senior psychologists, counselors, therapists, to marketing and mental health professionals, led by Khushbu. And although we started out by talking about our main agenda was to ensure awareness, increased awareness around mental health, and gradually we also moved to digital therapy. But we also had this realization soon that when it comes to our vision, it essentially starts at the grassroots, which are future counselors and therapists, as well as people who are looking to understand not just psychology from an academic perspective, but also from an awareness perspective, which was the reason why we started conducting workshops and webinars um, around various topics, right? We started off by understanding the effect of COVID-19 on, interpersonal relationships, to more, we've had, concepts around psychoanalysis, the subconscious mind, and more. So if any of you is interested, we will be sharing the details of the sessions that have been conducted. You can view them on our website, on our social media pages, the links to which will be shared in the chat section in some time. So, with yes, that's where we are today, and I would definitely like to thank you all again, because without you, it is definitely not possible, right? So, coming to our session for today, we would before I talk about a session for today, I'm not sure how many of you are aware, but our Sunday series was something that we had started, I think, more than a month ago, right? With the objective of trying to understand uh, the life of a woman, right? The journey. We were hoping to capture that in a woman's life there are various roles that she has to undertake, right? There are various hats that she has to wear, and with each role there comes a whole new set of challenges that impact the mental health in a very different manner. The way it impacts my mental health would definitely vary from the way it impacts yours, right? So with with the agenda of trying to understand that what are these ways and how can one tackle them, we started this series. Some of the areas that we covered. So essentially, we wanted to cover all the aspects that range from how a woman is impacted physically, psychologically, as well as financially. So some of the topics that we've covered range from understanding puberty in adolescence to to understanding how financial security plays an important role. And there have also been sessions around postpartum and antepartum depression. So all of this can be viewed on our social media pages. And talking about a session for today, right? The effects of marital discord on a woman's mental health is. Before I request a speaker for today to join in, I would like to give a very short introduction, right? Given that some of the aspects that I mentioned that we've covered so far, understanding marriage, the effects of how a woman post marriage. I wouldn't go by the stereotypes, but there is definitely some amount of compromise and adjustment which is uh, attached, more on the woman's side, I would say, which brings about a whole set of challenges, not just emotionally, but also in a whole lot of different ways, right? So with that, if if you add on to it uh, unsettling issues, I mean, if you don't have an understanding partner, or if things don't go really well, right? So, and if you have a professional career also to look at the side, and if you have kids, it brings an incredible amount of I would say pressure on the woman, right? And then there are not a lot of people that you can actually voice out your problems to and how to deal about it. So we have a couple of questions around it, and how one can approach help, how can one go about it, right? So we have with us Vinti Mittal today. Vinti comes with a rich experience of over 11 years, and she is currently a registered counselor at the Singapore Association of Counselling, and she's working. She's also working as a director of the SACAC, and she offers counseling for couples, for adults, for kids, as well as families. And to talk about her approach, right? Vinti's therapeutic approach is interrogative and person centered, which is slightly different from which is a slightly different and changed approach from processes that you would have usually come across, such as ACT, EFT, CBT, image transformation therapy, to name some of them. So thank you, Vinti, for joining us today. We're looking forward to a great session.
Thank you for having me.
Hello?
Can you hear me?
Yes, I can hear you.
I said thank you for having me.
Thank you. It's a pleasure. We look forward to having a great session today. I was just taking our participants to our topic for today, and Vinti, we have a few questions that we would like to discuss with you, and I mean, this is my suggestion that we can start with these questions, and as and when the participants have their own queries, we have our team who can, help me, who can help, bring the questions to me, and then I can, you know, discuss this with you. Does that work for you?
Yeah, it does. It does.
Okay, I hope everybody is aligned here. So with that, we're gonna start our session for today. Uh, so to start with, my first question is about how, just for a woman adjusting to life post divorce or post separation can take its own can take variable amount of time for women. Sometimes it can be months and even years, right? Occasionally. And through this journey, women go through several emotions, right? It's a whole different ride of emotions, which may make them susceptible to conditions such as post-traumatic stress disorder, or also adjustment disorder, or situational depression. How would you suggest that, can women deal with it?
Sure. I like to set a little bit of base of what marital dissolution or divorce is actually, and how it is perceived, and how the individual who's going through the process may feel from time to time. Yeah. So if we see that in our culture, especially the Indian culture, marriages have a very important role, and they're kind of sacramental for all of us. A lot of effort is being put into the marriages, organizing a marriage, and a lot of emphasis is put on. I mean, now it's changing, put on making it work. But when two individual goes through this process of divorce or marital dissolution, it actually becomes a life-changing event. Not only life-changing for the couple, but actually the parents, the families on both sides, and more if there are kids involved. So it has a bigger impact. And every individual involved in this process, directly or indirectly, would react differently.
Right.
In our terms, generally, we say that they go through the process of loss and grief, in actually in a psychological term. And everyone goes through that phase of loss and grief. It is actually, they endeavor in emotional changes, emotional stages similar to the loss of someone or a death of a loved one. So they're generally good. There are 5 stages of grief and loss, which everyone goes through, which includes denial, anger, bargaining, depression, which is sadness, not a clinical depression, before they reach the final stage, which is acceptance. And during the process of grief and loss, the people tend to move from stages to stages, and it takes them, different people grieve differently, and it lasts at a very different, lasts for a different length or an extent in different people. Some would grieve for 2 months, some 6, some take years to come out of the grieving process. And why couples grieve is because there is an emotional connection. They have been bonded for many years or few years, or there are other modes of connection. There is basically an emotional connection of some sort. So letting that go is very, very difficult. Over the time in a marriage, you develop codependency, which is again leads it very difficult to grieve that process, because all of a sudden you're like left on your own. Yeah, and the third is lifestyle change. So when a couple is together, there's a certain lifestyle that they get used to. But when there is an individual and that this relationship breaks, so the family is divided into 2 sets of family structures. So there is possibility, or there actually does happen that the lifestyle changes. For one person, one partner, the lifestyle actually might get better, whereas the other, it might deteriorate. So all these 3 factors makes it difficult for people to grieve. And that's why the extent or the period for which they grieve varies in different individuals.
Right.
Yeah. So again, because it has a significant impact on the lives, the well-being of the parties, right? The couple, the partners, all the families get impacted. How it's presented in a very, very different way for each one. Some would, experience anxiety, worries. Some would have depression. Some would have had issues with substance abuse, and which again makes it very difficult for them in the process. If there are kids involved, this becomes very difficult. Then there's difficulty with the work-life balances. There's difficulty in child rearing. Who takes the responsibility? If one of the partners is not functioning, then what really happens? So manifestation of the marital dissolution is presented in a very different way. Also, it depends on the personal resilience of the individual. How resilient are you? Resilient in terms of psychological well-being, physical well-being, community well-being, community resilience. So again, it depends on how resilient you are. And based on that is how impacted will you be? What will it look like? What will your mental health look like after such a big life-changing event in your life?
True, true. Right. Okay, I think that's a great note to start with. I think we can then proceed to the next question, right? With respect, talking about how to, deal with treating if you've been diagnosed with a mental health disorder post your separation, or while dealing with the divorce. What would you suggest? Under what circumstances is it advisable to prescribe medications such as antidepressants to women who are, suffering from anxiety or depression?
Yeah, like I said, it is a very tough period that, especially if we concentrate just on the women, is go through. Women actually have a much tougher time to deal with the divorce because, again, genetically, women are more prone to, they take decisions in life based on emotion. So they do get impacted more, if you see. Yeah, it's a very, very tricky question where to go to the pharmacology way or not go there. And if you see, as therapists, I think it becomes a challenge when we as therapists introduce the concept of, how about seeing a psychiatrist? How about getting medication? So the general consensus is there's immediate reluctance, immediate resistance. No, I don't think I need that. Without realizing that pharmacology sometimes, in some cases, I don't say all, in some cases becomes a very important component of the treatment plan. So there are two ways actually people approach this. So either they first see a psychiatrist and then the psychiatrist recommend that the client, along with the pharmacology, works with a therapist, or sometimes it's the other way around. The client comes to or people come to the therapist, and then the the individual works with the therapist in deciding what is best. How do we go forward in the treatment plan? So it's done best when there is a discussion around, discussion between the therapist and the individual before actually going to the, seeing a psychiatrist, before seeking the psychiatrist support. Unfortunately, there's so many common myths around taking medication. Some of the common ones that I keep hearing is, you know what, my friend got addicted to it, so I'm not even going to do that. And it's going to, my friend said, or my family, someone in my family said, they were so groggy, they just couldn't function. So there are different kind of myths that, or stories or narratives that people, tell us and give, or they've heard from someone without actually understanding under what circumstances was that decision made to include, the pharmacology. But it does from time to time becomes a very important component to the treatment plan. And again, it's a tough process to actually, so sometimes it's a short-term introduction of medicine in the treatment plan. Sometimes it's a long-term. Again, it depends on the diagnosis. If it's anxiety, depression, and nothing else, then probably it's a short-term process. It's a short-term medication process. But if there is intensive diagnosis like bipolar, schizophrenia, yes, then there is going to be a long-term, medication as a part of the treatment plan. But what really I've seen is that generally the pharmacology or the psychiatrist in Singapore, we generally do recommend clients to just see a psychiatrist for all these psychological issues rather than any other medical doctor, because they are specialized in this area and they know how to work with clients. So part of my practice is the client, the therapist, and the psychiatrist actually work together as a team to provide that support. And a lot of time, what really happens is a client goes to a psychiatrist or a medical doctor, they get a prescription, but it takes actually some time to get the right dosage of the medication till the dosage is adjusted, and it takes a few visits to the psychiatrist to ensure that it is effective. Because if the dosage is low than what is required, it's not going to help. If it's too much, then it's also not going to help. So it's about being patient. It's about trying and working as a team to get that thing right. And if you see, divorce is an issue. It does bring up a lot of, it could initiate or could trigger a few mental health issues. So that probably becomes important that if you're struggling, please seek help. Seek help with a therapist who can then help you decide whether you do need to go for a pharmacology direction if you need that. And there's some issues which actually can be dealt with between the therapist and the client, but then there's some that needs to be, and it should be.
Right.
Then it should be. So again, it depends on the case-to-case basis. And also, a lot of times I tell clients, is to make a trade-off. Because you're in a situation of a divorce or a marital dissolution, you still need to function. Now, the trade-off is, are you better with no medication and unable to function? Or should you take medication and function so you get through this process? Because eventually you have to deal with what is coming with the divorce. You've got to pick yourself up and start your life all over. And if they're kids, if they're parents, then it becomes even more imperative. It becomes more important for you to pick yourself up and go that. So then in that situation, the medication actually becomes a very small part of the whole process, because eventually you've got to get up and start functioning.
Definitely. So I have a continuation to that question. Talking about medication, I think the main takeaway here remains that one should always seek professional help rather than going by myths or what you hear from people, because one person's experience may not necessarily stand true for another's.
Yeah, you will need to see a psychiatrist a couple of times till the dosage of the medication is, or the type of medication. Some salts you might react to some salts. You might so there needs to be a couple of visits to ensure that the medication is working for you, because eventually it is supposed to support you, not to make you feel worse. So that's not the aim.
Right.
Yeah.
Right.
And a lot of people who get addicted is because they don't work in therapy. Then because taking the medication is an easy way out. But your issues are not going to go till you work it out in the therapy. So they need to go, pharmacology and therapy needs to go hand in hand.
Right. I think that's a very important point you mentioned, because a lot of times we, usually see that people prefer, addressing their problems via medication rather than working it out. They see it as an easy way out.
So the medication has a purpose, but you still need to sort out your issues, and that's how you're going to feel much better. Unless there's some other major issues, which again, the presentation, or it's going to be much easier for you to deal with it, even if you have you have a mental health issue, which is not going to go away.
Right.
So it will help you manage the issue. It will help you get through life, managing your life better.
Right. And talking about the different ways and how to deal with it, right? There's also talking about arts based therapy. What are your thoughts on how useful are therapies such as art or alternative therapies such as acupuncture or massage therapy, and also techniques such as yoga?
So if you see, I actually am an integrative therapist. So I use a lot of different kind of therapies, and present. It's like my toolbox. So every different therapy has a purpose, but it's not just that one therapy is going to work, because the situation presented and how the case developed, session after session, the needs will change. So I would say anything that makes you feel better, but is good, it works. Like some things will work at some time, some different therapy will work at different times. So it is always, the more experienced the therapist is, it's about having more tools in your toolbox, and you at different times, different therapies are going to work. If somebody is, have psychosomatic pains, then probably, massage is good, acupuncture is good, but that can't be the only source of, that can't be the only modality that you use. Because again, there are issues that needs to be dealt with, that needs to be talked out. Expressive therapies are really helpful again, but then it's always used in combination of something else. Can't be just that I say, okay, just use art therapy. You do still need to use other modalities to work with it. And other modalities and different modalities work at different time.
Right.
Like I can't use an art therapy for an individual who is resistant to using art. So that's not going to work. I might use sand with that, which is another expressive therapy. Or I might use play with it. I might use dance therapy. So again, it is about having these different kind of tools in my toolbox and use it as, as a package.
Right.
Because they all have a purpose. They all have a role.
Right. Okay. So I think that's a very valid point. When you mentioned that it depends on the tools that a professional has in their toolbox, and what I mean, you can't really guarantee one form of an expressive technique will solve all your problems in one go.
All have a
Perfect.
purpose, and they're all good to have in your toolbox and might work. They all work in different form or different combinations.
Definitely. I think that's a great way to put it. And also, first, some of the thoughts that I think the viewers might have. I mean, usually these are certain misconceptions, I would say, with respect to therapy, right? You try to, I think one usually does accept it or internalize it that, one way, I'm taking one form of therapy that probably would put an end to everything. So that's a great way to bust that myth. I have one question, so I'm going to try to combines a couple of questions from the viewers, talking about the impact of a mentally ill partner on the woman's health, right? So some of the questions which I received were, what if the partner is narcissistic, or suffering from or is schizophrenic, or is suffering from OCD, and not they're unwilling to address the issue or solve it. How can then women address it?
So so what we see is family as a system. A family is a system consisting of different units. So if one unit in the family, if the husband is not functioning, then the whole family system gets impacted. And if he is not doing what he needs to do, but that doesn't mean that the other party or the women cannot go out and seek help. She should go out and seek help, and seek help in terms of see a therapist and work as how she can help herself and help the family unit, because it's not only her that is getting impacted, it's the kid and the whole family environment. And maybe she, while working with a therapist, she's able to find ways to help the partner, help the husband, and eventually something might work, and the partner might actually agree to working with either a therapist, or in this case, if it's intense, probably need a pharmacology way. But she should not suffer in silence, thinking that nothing can be done. So she should definitely reach out and seek help for herself, so she can help herself, her family, and eventually the partner.
Right. I think this then extends to all kind of medical conditions, right? I think we've also questioned with respect to bipolar partners. So, same as well.
Even depression, actually, that's what they're saying. Depressive symptomology is one of the major issues of divorce. If one of the partner is depressed, then there are very high chances that the marriage will eventually break down.
Okay. I think we'll come on to that question. We do have.
Yeah, it's a big contributing factor.
Right. I think that is then my next question. That do you think women who have had previous episodes of anxiety or depression are at a higher risk of again undergoing depression, after the divorce, than women who have no previous history?
So basically, I was, this is a very interesting question, and even I was struggling with this question, how would I address it? And I went into reading some journal articles, and there was a panel study from the Journal of Marriage and Family, which says that a couple of researches have been done on different population groups to see whether the relation, what was your question?
My question is
between marital status and individual's well-being, right? So the outcome of the study was that people who were living with a spouse were recorded much better physical and psychological well-being as compared to individuals who were living by themselves. So if one of the partner in the marriage is depressed, right? So the depression doesn't actually doesn't change whether they're married or they're divorced. But in cases where they're divorced, but eventually over the time, the depression increases because of greater economical problems, perception that their lives, the standard of life or their lifestyle has deteriorated, and they don't have anybody, close enough with whom they could emotionally connect. So immediately after the divorce, nothing's there. The research or the study didn't say that there is change in the depression, but over the time, the depression increased because issues increase. Issues like around the economic, so the economic hardship increases, lifestyle decreases. If you're used to a certain lifestyle, and if it becomes like if you're living in a big house and all of a sudden you have to live in a small apartment, your lifestyle decreases, right? You don't have anybody close enough to confide in, share a life with, share the the responsibilities, and there's so many changes that happens, and which becomes a cause of the depression to get worsened.
Okay, so you're saying indirectly it can, if somebody does have a history of experiencing depressive episodes in the past, then undergoing problematic situations can impact.
So the depression will worsen because of the hardship of the divorce that comes after the divorce. So if you were living together as a couple and there are children involved, and if the children goes in, the women gets the custody of the children. So if she has to be a single parent of 2 or 3 kids and, you know, every responsibility, of course, it's going to be really tough. And that might lead her depression to get worse.
Right.
Yeah, so when you're in a marriage, so the responsibility is somehow shared, right? Either the economic responsibility or child rearing, or, you know, some kind of, there is some, at least something will get done. But when you're on your own, of course, you're just responsible for everything about the children. So it gets difficult.
Right. I think that definitely does answer that. When moving on to the next question for today's session, my next question, Vinti, then is about how separation involves multitude of challenges in the form, as we were discussing, right? Emotional challenges, this financial burden, along with uh, another aspect that you'd mentioned, grief, right? With respect to the collapse or the end of the marriage. And in some ways, the person ends up revisiting or I think questioning their identity, their social choices, their networks, and also changes in parenting practices. So how important do you then think is the role of support systems, and especially for a woman, right, given that we're talking from a women's perspective? And what do you think? There are two parts. First is what do you think is the importance of support systems, and second is about could you suggest some best practices that a woman can follow so as to ensure that her identity does not dissolve?
So that's actually such a valid question, you know. So when a divorce happens, and I'm going to focus more on women because I think women go through this more than men, is that there is a loss of identity. There are few things that happens. So there's some existential questions that come into that a woman faces and need probably is looking for answers, is because if you see in an Indian context, and I know it's changing, right? We're kind of going into the more modern world, is a lot of times women's identity, I can say in the past is uh, a lot of the identity came from the husband or the children, you know, so and so's mother or so and so's wife. So when the divorce happens or the marital dissolution happens, the first thing that comes is, who am I? The biggest question is, who am I? What is my purpose? Why am I here? You know, so there's a women starts questioning the religion, starts questioning her upbringing, her value systems. I was brought up with the thought that marriage is going to last forever, and but this is all gone. Everything part of my life has changed. Starts questioning her religious faiths, her belief systems. Everything comes into question. And it's going through a divorce is a very, very long, drawn, tiring process. Yeah. And so another thing which happens is women, they shy away from connecting to others. There's a sense of embarrassment. The reasons could be different, or moving towards isolation. So it becomes a part of that. There is sometimes embarrassment. There's, there could be different reason why one tends to move into isolation when something like this happens. But the thing is, and anyway, going through the process of divorce, it being long and tiresome, also makes people feel very lonely.
Right.
But as human beings, we have a very high need of connection and belonging. And we need connection and belonging more, especially in the times when we are in trouble. Like if you see during the COVID, this staying at home had become such a big issue because we are all facing or feeling the dangers, but then we are isolated. You see that so there is a need, a human need that we have, humane need that we have, is to reach out to our loved ones when we are in trouble. So the need becomes much more. but somehow this whole process makes you feel very lonely. So it is important because it's such a difficult process, and not only you are involved, children, families, everyone is involved in this. It's important to have a strong support system. I'm not saying like 20, 30 people, but at least even if you have 2 or 3 people who can actually support you through this time and help you answer these questions that you're going through. Because the more questions you have, the more tendency will be to be isolated or, not face the world. But you still have to deal with it. You still have to go to the legalities. You still have to pick yourself up. If you're not financially independent, you still have to pick yourself up and find a job. Do the things that you need to do. So it is so important to have this support system around you, though you would want to get rid of everyone around. They're going to be the support that you need. They could be providing moral support. They could provide emotional support. They could be providing economic support. They could provide anything that you need. Even if their kids involved, somebody comes and say, okay, I'm going to take your kids and look after them for a week. So that will give you time to recover from the grief and loss that you're going, whatever you need to do. So indirectly, it is a big support. Yeah. So the best people to help support that you should have and is to have a therapist. So therapist has got multiple roles in your life. They're probably the people who are the most non-judgmental people, who are always there to support you at whatever cost. Yeah, so they're going to be a big support system, but people don't actually do that. A lot of people forget that aspect of that role of a therapist.
Right.
So therapist is important. Your lawyers are supposed to be part of your support team. If you can get divorce coaches, the people who are specialized in, to support you if you're going through a divorce. So those are very important people. Your friends, your family. So if you have this few people in your support system, I think you should be fine. You should be able to get through this time. And it is tough time. It is a life-changing event. It takes a lot of courage to go through this.
Definitely. I think you rightly pointed out that being surrounded by non-judgmental people is critical. Your support system should, even if you, I think, choose friends or families, having non-judgmental ones is especially critical while dealing with it. Talking about divorce coaches, I think I had a question from one of the participants. Yeah, so the question is that when a couple approaches court for divorce, they're advised uh, counseling, right? So, what are your thoughts on that?
So again, is this pre-divorce or when they've actually applied for divorce?
I don't think that was mentioned.
So if it's pre-divorce, it's one of premarital I mean, if there are issues in the marriage, it should generally be a good step is to seek marital counseling. See if there is a possibility that the marriage could be saved for some pretext or the other. So that counseling or therapy can definitely support the couple. And that will even help find out, like I said, right? Depressive symptomology could be a big factor in marriages breaking down. So when the couple sees a therapist, the therapist should be able to identify if one of the partner is depressed or has any other mental health diagnosis, which is contributing to the relationship to be breaking down. So it is about going to a therapist is about giving the marriage a second chance as to is it possible to work it out? Because eventually marriage is something that needs to be worked out. It's never perfect. So
Right.
maybe whatever is the cause of distress or whatever is the cause that the relationship is breaking is it's giving it a chance to work on that and see if the marriage can be saved.
Okay, this is after applying for divorce. So
After, so again, if there are kids, then you still need to co-parent the kids. So at that time, therapy is really, really helpful. So in this, there are two scenarios. One is you may not need to seek therapy if you're going to totally break off, right? Then there is probably no connection. But then if you have anybody who's going to keep you connected, then it might might be helpful to seek therapy to see how you can work that. But then if you have kids involved, then you still have to co-parent the kids. And that is such a big and most difficult task, is how do you be cordial and work towards co-parenting the kids, because kids are involved in this, and whatever your relationship is, and I mean relationship is going to be in the future, is going to impact the kids big time. So it becomes, yeah, it is really, really helpful to seek therapy if there are kids involved or anybody else that is going to be, keeping that connection together, connect the couple that needs to connect, because they need to decide how they're going to progress, how they're going to move forward, if they're going to stay connected with each other.
definitely, that's a great insight. Moving on, I have another interesting question from one of the participants. This is around if you could throw some light on what do you think are the main reasons, or what do you think is the main cause for the divorce rate going, for the increased divorce rate in the present generations compared to older generations?
Are you kind of asking in context to the Indian context?
Oh, yes, yes. This is in the Indian context. Also, I think, as you'd mentioned, right, if we also view this from the lens of the lockdown and the COVID scenario, right? So, keeping both the scenarios in place, what advice, would you have for couples?
Okay, so you're asking why is the divorce rate going up? Couple of things in this, okay? I'm going to put my personal view also in it, which might not be right. So I think more women are very clear, at least the young generation. Yeah, so the little bit that I'm still connected when I come and see family, friends, is women are feeling much more empowered to make their own decisions. They're not ready to just take what is given to them, because they are more independent economically and emotionally, so they don't feel that they need to kind of compromise as much as the previous generations did, because also the previous generation women were not economically independent. So more women are educated, more women are more economically independent. They know what they want. They're more clear on what they want in life. So if they're quite courageous in taking that step of moving out of the marriage if things don't work. They do give it a chance. I mean, some do, some don't, but they do give it a chance. And if it doesn't work, then probably it's easier for them to take that decision to walk off. What the other thing what I have seen is that the stigma that was attached to divorce in the past is not as strong as is not strong now, as strong now than it was a few years back. So it's now commonly heard that yes, so and so has got divorced, so and so separated, so and so is no longer in her marital home with her husband. So it's not something which is unheard. It's heard more and it's more acceptable. So the stigma has reduced around marriages breaking. And I think these are the two major reasons that the divorce rates are going up. Now, during the COVID, I know a lot of these divorces have the numbers have really gone up And if you see in our practice also, we are seeing such an upsurge of cases relating to marital issues is because so in isolation, I think we all were forced to live in close proximities for an extended period of time. So the good, bad, and ugly, everything was there. And there was no escape for anyone. So you had to deal with it. And people were on the edge. There was lots of fear. There was lots of emotional, so everybody's probably the emotional resilience was being put at test. How much can you deal with what you have? And then there was no break because I don't, India, I think you can still go out, but in Singapore, we just couldn't go out of the houses for like 3 months or something. You could only go out for grocery shopping or exercise. Nothing else we could go out for. So people were forced to be together, deal with whatever. And it also gave a lot of people time to reflect. This is not going to change. So is this what I want for the next 20, 30, 40 years of my life? So all these things led, I think, to a lot of the divorce cases increasing. But on the other side, I personally have seen a couple of couples who were actually had decided to divorce, but then they got together because it gave them a chance to rework on their issues and see if they could, if they were both happy to work on it and work together and make the changes. So there were some happy stories too, but the others were actually, so it brought the reality in their face. Everybody had, the reality was in the room. So either you deal with it or you don't deal with it. If you don't want to deal with it, and then knowing that this is not going to change, I'll have to deal with it for the next 30, 40, 50, 60 years of my life. Do I want to do it or not? So it also gave a lot of people time to think, reflect. What do I want in my life? What does my life should look like? Is this person going to help me, live my life, meet my life goals? Or is this a family goal that I want to achieve? Is this person the right person that I could achieve my family goals? So it was a lot of, lot of things happened. And because there was no break, it was right in your face. So normally, when all this was not there, so we all get a chance. We do have issues, but we do get a chance. We do get a break from it when we go out, when you go at work, when we go out and we meet friends. So it helps us to deal with those things. But here there was no break. So reality hits you and you take a decision.
Right. That's, I think, a great way to put it, and especially nice to hear about not just the the dissolution of marriages, but there were cases of people working things out as well. Is definitely inspiring to hear. I think we do have two more questions from our end, but also some interesting questions from the viewers. So I'm going to quickly, go through these. So the first question is that do you think identity loss creates problems for women who are passionate about their career, and what kind of in what way does it impact their self-esteem, especially after going through the process of divorce?
Can you come again? Sorry.
So the question is that we were talking about identity loss, right? And especially when looking at women who are passionate about their careers, what kind of an impact do you think it has on their self-esteem once they're part of the, as they're undergoing the process of divorce or post-divorce?
So for working women, I think it is I would say it's a little bit much easier than a non-working women, because if they're passionate about their work and they're involved in their work, so that is part of their identity. So at least they have something to hold on to. Whereas the non-working women, I think that they have face a bigger challenge than the working women, because it is the family that defines them. It's the marriage that defines them. It's the surname that defines them. And when that is taken away from there, so the impact on them is more higher. So working women, she would, on her personal side, would have issues, emotional issues, in that process, because yes, there is a lot of trauma happening. There's a lot of emotional upheaval happening, might not be able to perform at her full capacity like she would. And if they're in a high performing job, might even lose their jobs, or, but they will still be able to pick themselves up and, find another job, or find something to do. So they will feel low, they will have an impact on their self-esteem, but it's easier for them to pick them up. Because they do, on the other side, it's not just the job, they have the economic stability. So they have something to hold on to, and their struggles in life is much less than a woman who's not working.
Okay.
Yeah, so that is, I think the woman who's not working is the one who needs much more support and would go through much more social, emotional, psychological issues than a woman who is working.
True, that's an interesting way to look at it, and I think that also makes a lot of sense. Women with support, whether financial support, can deal with the situation in a lot better manner. Perfect. I think then moving on to my next question was also something that we were discussing earlier, right? Women with social and economic resources, do you think they're in a better position? I mean, yes, it does answer that they are in a better position to
Have something more to hold on to. It's only a part of their life that is gone, right? But they still have their job. They still have the finances that they need to support themselves, or, so when you go to office, you do have a support system there. You do have a support system of friends. So you have all those, but I think the issue is more for the women who's not working.
Right. And what would you say, with respect to the comparison of the situation in India and in other South Asian countries?
Yeah, I think women, again, I could be really wrong in this. I think what I am seeing is, I think women in India are really catching up, and we see a lot of increase in education, which is empowering for them. They are moving at a very fast pace of, looking after themselves financially, socially, emotionally, physically, yeah, and spiritually. So I think they are ahead of the curve. I would say that, but I'm not sure if that's the right answer. This is my personal opinion. So I can see a lot of changes happening in India now. And I think it's for the positive. And I see these women standing up and saying no. They're able to say that no, this is not working for me. This is
Right.
not what I want.
I think a lot of people might agree to that. There definitely has been a change when it comes to the Indian scenario as well. So that's a positive side. I think we're also almost close to our time. So I'm gonna quickly move to my closing note before I take on the rest of the questions from the participants. Talking about the impact of parental conflicts or the effect of a divorce. How would you say that it influences or affects the mental health of the children, right? And do you think depressed adolescents with separated parents are at an increased risk of recurrence or even developing symptoms of depression in their adulthood, and other also at a risk of developing other mental health disorders such as PTSD compared to depressed adolescents of non-separated parents?
The thing is, if there is a marital conflict, there is stress. There is stress in the family system, which affects the cognitive development of the child. So, witnessing such conflicts can harm their their stress response system, affecting their mental and intellectual development. Yeah. So conflicts have direct impact on the child's emotional security. And that eventually is associated with the child's adjustment problems, including internalizing or externalizing problem and impairment in the social and academic functioning.
Right.
Yeah. So the other thing which this impacts is so conflicts, marital conflicts impact the threatening their goal of feeling safe. So it's impact their security, the feeling of safety and security which a child has. And child to feel that safe and secure in the environment may develop over the time. If the conflicts continue, they may develop certain behaviors to deal with the conflicts. And these behaviors over time can become into other, can actually become problems. But this is something that they develop to protect themselves from the conflicts that was happening at home. And yes, similarly, like, for women, that the mental health issues becoming an issue after a few years of the marriage, a similar thing. If an adolescent is already having issues, so the divorce or the marital dissolution is eventually going to impact the well-being of the adolescent. And if there were like 5 issues, now with the parents separated, economic standards, dropping, lifestyle deteriorating, and single parent, either one parent or a single parent, their issues are all going to increase. When the issues increase, then the mental health deteriorates, the well-being of the individual deteriorates. So with time, it is going to get worse if the right support is not given to the adolescent or the child or anyone in that case.
Right. I think that's important. Then paying equal attention to your children, be it adolescents or whatever age group they belong to. Um, their mental health should also be taken into consideration to ensure they are minimally impacted by the situation. I have an extremely interesting question from which has been asked by a lot of participants. So this is about what do you think? Can two people who have undergone the trauma of divorce become good partners, or how can one deal with the concept of relationship phobia?
If they work on their traumas, okay, if they work on their grief, if they work on themselves, definitely they can overcome and come back together. So lately I've seen so many of these youngsters, youngsters means in their 30s, who have actually gone through bad relationships and now have a fear of getting into another relationship because the memories from the past experience keeps coming back. And that either, they become very passive or they become very aggressive. So their coping mechanism, either being passive, is not even attempting to find a partner, but they know deep down they need a partner. So they got to work on it. Or they become very aggressive. So when they meet somebody, they're like asking millions of questions in the first date. So it is because they haven't worked through that. And then in therapy, we work through them, then we help them how to, approach, go back into that dating scene and, through role plays and working on their cognition, what's really happening, what was the past experience, working with those traumas. So it's absolutely, absolutely possible. Again, this is a work to be done in therapy.
Okay, I think that's a great response for people who think that they are undergoing stress or have their inhibitions or fears attached to relationship. Perfect. I'm quickly gonna check if we have any more questions, because we are, almost at our end time for this session. Mm, just a second. Okay, so I'm gonna quickly just check with the team if we have any more questions, and also, okay, yeah, we do have one question. What are your thoughts on the effectiveness of divorce coaches? I mean, we were having conversations around it, but what would your opinion be?
So again, I would say if things are not working, to seek out help. If one doesn't work, try something else. It's all about the effort that you put in. And with every try that you do, you will definitely learn something new, which you can take with you and which will be useful. And unless you try, you wouldn't know.
Right.
Yeah, so it's all about trying.
Definitely. Also, another quick question. I think this was also pretty important. What would you suggest can be done for to increase, the acceptance by families towards a divorced uh, daughter?
Again, I should say send them to counseling. I think it's all about the pros and cons. How what would the life of an individual would be when they're in the marriage or the relationship, and how is it different from how they envisage their lives, or what are the struggles and what are the challenges that they're facing, and if there is abuse, then do you really need her to go through those abuses, and is that what you had planned for your daughter? So all those things, all those kind of processing is very, very important. And also it is about understanding that if she has tried different things, then knowing that what has she tried and did it help. If things are not going to change, then it is about evaluating, do we really want her to be really unhappy in that relationship, or should she come back home and refigure out her life?
Okay. I think now I'm gonna move to the closing note. We've had a extremely insightful session. Thank you so much, Vinti. It was great having you. The questions that we received from the participants as well were definitely. I'm sure. I'm hoping that we have an increased understanding when it comes to marital dissolution or discords, and how can one. I think the main takeaway from this is going to be approaching therapy, and also, viewing, I mean, not completely depending upon one form of it to, completely solve your problem, right? Looking at it from a more, I think, being more open
Open
towards
about
practices, right? Think that brings us to the end of our session. We've covered an extremely important and a sensitive topic from the aspect of the couple, of the offsprings, of the support system, and I would like to thank our participants as well, for joining in. It's been great to have everybody. I'm going to take your leave now, and we look forward to connecting with you again, Vinti, for another interesting session again. So thank you from the team Healthy Minds World. We'll see you next Sunday on another interesting session around women's mental health. Thank you so much. Have a nice day.
Thank you.
Thank you. Bye bye.
Bye.